Question 1. What is the most appropriate nursing intervention to prevent increased intracranial pressure in a patient with a head injury? A. Place the patient in a supine position with the head flat. B. Administer an antiemetic before repositioning the patient. C. Elevate the head of the bed to 30 degrees. D. Place the patient in high Fowler's position. Answer. C. Elevate the head of the bed to 30 degrees. Question 2. Which task is appropriate to delegate to an unlicensed assistive personnel? UAP. Caring for a stroke patient with right-sided weakness. A. Assist with feeding a stroke patient with right-sided weakness. B. Educate a patient newly diagnosed with multiple sclerosis. C. Monitor a post-craniotomy patient for signs of increased ICP. D. Perform a neurological assessment on a newly admitted patient. Answer. A. Assist with feeding a stroke patient with right-sided weakness. Question 3. Which patient requires immediate nursing assessment based on neurological priority? A 67-year-old with Parkinson's disease who is requesting assistance with ambulation. B. A 72-year-old post-stroke patient experiencing new-onset confusion. C. A 45-year-old with Bell's palsy receiving facial massage therapy. D. A 60-year-old with peripheral neuropathy asking for socks. Answer. B. A 72-year-old post-stroke patient experiencing new-onset confusion. Question 4. Which post-operative patient condition requires immediate intervention? A. The patient with chronic migraines requesting PRN acetaminophen. B. The post-op spinal fusion patient with new-onset lower limb weakness. C. The patient with Alzheimer's disease wandering in the hallway. D. The patient with epilepsy sleeping after a seizure. Answer. B. The post-op spinal fusion patient with new-onset lower limb weakness. Question 5. Which task is appropriate to delegate to a UAP? A. The UAP documenting neurological findings. B. The LPN performing a focused neurological assessment. C. The LPN titrating for mannitol for increased ICP. D. The UAP assisting a Parkinson's patient with toileting. Answer. D. The UAP assisting a Parkinson's patient with toileting. Question 6. Which action is most appropriate for the RN to assign to the LPN? A. Monitor for pupil response in a patient with a head injury. B. Assess deep tendon reflexes post-stroke. C. Evaluate changes in LOC in a traumatic brain injury patient. D. Educate a family on seizure precautions. Answer. D. Educate a family on seizure precautions. Question 7. What is the appropriate delegation regarding a dementia patient needing assistance? A. Assign the UAP to assess for limb drift in a stroke patient. B. Delegate toileting assistance for a patient with dementia to the UAP. C. Ask the LPN to educate a patient newly diagnosed with ALS. D. Assign the UAP to administer oral medications. Answer. B. Delegate toileting assistance for a patient with dementia to the UAP. Question 8. Which vital sign change indicates possible increased intracranial pressure? A. Bradycardia and widening pulse pressure. B. Hypotension and tachycardia. C. Dilated pupils and bradypnea. D. Tachypnea and narrowing pulse pressure. Answer. A. Bradycardia and widening pulse pressure. Question 9. What is the priority nursing action for a patient with suspected cervical spinal cord injury? A. Have the patient hyperextend the neck to visualize the area. B. Apply heat to the area for muscle relaxation. C. Keep the neck neutral and stabilize the spine. D. Roll the patient to the side for airway access. Answer. C. Keep the neck neutral and stabilize the spine. Question 10. How should the nurse assess a patient who is difficult to arouse following a head injury? A. Allow the patient to rest for 1 hour before starting an assessment. B. Ask the family to help arouse the patient. C. Check responsiveness using verbal and painful stimuli. D. Notify the provider immediately without assessing first. Answer. C. Check responsiveness using verbal and painful stimuli. Question 11. Which nursing intervention best reduces the risk of increased intracranial pressure? A. Encourage high-protein diet to support healing. B. Avoid head flexion and keep the patient flat. C. Elevate HOB to 30 degrees and keep neck in neutral position. D. Apply cool compresses to reduce fever. Answer. C. Elevate HOB to 30 degrees and keep neck in neutral position. Question 12. What is the nurse's priority action during a witness seizure? A. Administer seizure medication and chart findings. B. Stay with the patient and call for help. C. Place a tongue depressor to prevent biting. D. Restrain the patient to prevent injury. Answer. B. Stay with the patient and call for help. Question 13. Which task can the RN appropriately assign to the LPN in the care of a patient with seizures? A. Request the UAP to apply a transdermal patch. B. Ask the LPN to monitor for increased ICP in a TBI patient. C. Instruct the LPN to reinforce teaching on carbamazepine. D. Have the UAP reposition a paralyzed patient. Answer. C. Instruct the LPN to reinforce teaching on carbamazepine. Question 14. Which finding in a spinal cord injury patient suggests autonomic dysreflexia? A. Loss of bowel and bladder function. B. Bradycardia and hypotension. C. Sweating and goosebumps above the injury. D. Sudden headache and nasal congestion. Answer. C. Sweating and goosebumps above the injury. Question 15. Which patient condition requires immediate safety intervention? A. The Alzheimer's patient wandering without supervision. B. The Parkinson's patient requesting their next dose of levodopa. C. The multiple sclerosis patient with fatigue. D. The migraine patient complaining of photophobia. Answer. A. The Alzheimer's patient wandering without supervision. Question 16. Which task should the RN perform rather than delegate? A. Reorienting a confused stroke patient. B. Administering 4-diazepam to a seizing patient. C. Teaching a patient with epilepsy about triggers. D. Documenting cranial nerve findings. Answer. B. Administering 4-diazepam to a seizing patient. Question 17. Which action demonstrates appropriate delegation for seizure precautions? A. Ask the UAP to measure grip strength in a stroke patient. B. Assign the LPN to monitor for CSF leakage. C. Instruct the UAP to place seizure precautions. D. Request the LPN to assess cranial nerve 7. Answer. C. Instruct the UAP to place seizure precautions. Question 18. Which signs are most indicative of meningitis in a hospitalized patient? A. Headache relieved by standing. B. Nuchal rigidity and photophobia. C. Decreased blood pressure with bradycardia. D. Rhinorrhea and epistaxis. Answer. B. Nuchal rigidity and photophobia. Question 19. What is the best nursing action to reduce aspiration risk in a patient with dysphagia from a stroke? A. Encourage supine position during meals. B. Have suction available at bedside. C. Offer thin liquids with each meal. D. Instruct to tilt head back while swallowing. Answer. B. Have suction available at bedside. Question 20. Which task is safe to delegate to a UAP in the neurological care setting? A. UAP documents neurologic status. B. LPN administers 4-phenytoin. C. UAP assists with ambulation for a stable MS patient. D. LPN performs Glasgow Coma Scale scoring. Answer. C. UAP assists with ambulation for a stable MS patient. Question 21. Which patient should the nurse assess first following morning rounds? A. A patient with multiple sclerosis complaining of fatigue. B. A post-craniotomy patient with sudden restlessness. C. A patient with Parkinson's disease requesting help to dress. D. A patient with a history of migraines asking for dimmed lights. Answer. B. A post-craniotomy patient with sudden restlessness. Question 22. What is the most appropriate intervention when caring for a patient with suspected myasthenic crisis? A. Administer a second dose of anticholinesterase early. B. Place the patient in a flat supine position. C. Prepare for respiratory support and intubation. D. Encourage early ambulation. Answer. C. Prepare for respiratory support and intubation. Question 23. Which assessment finding requires immediate action in a patient with Guillain-Barré syndrome? A. Loss of deep tendon reflexes in the lower extremities. B. Bilateral leg weakness progressing upward. C. New onset of shallow respirations and shortness of breath. D. Numbness and tingling in both hands. Answer. C. New onset of shallow respirations and shortness of breath. Question 24. The nurse observes clear fluid leaking from a patient's nose following a head injury. What is the first action? A. Ask the patient to blow their nose. B. Collect the drainage on a sterile gauze. C. Apply firm pressure to stop the leak. D. Insert a nasal packing to control drainage. Answer. B. Collect the drainage on a sterile gauze. Question 25. Which task is appropriate to delegate to the UAP for a patient with advanced Alzheimer's disease? A. Teach the patient about medication compliance. B. Monitor for behavioral changes during the night shift. C. Assist the patient with bathing and dressing. D. Assess the patient's level of orientation. Answer. C. Assist the patient with bathing and dressing. Question 26. What finding would indicate the need for immediate provider notification in a patient receiving TPA for ischemic stroke? A. Mild headache. B. Slight facial asymmetry. C. Sudden decrease in level of consciousness. D. Mild nausea. Answer. C. Sudden decrease in level of consciousness. Question 27. The nurse assigns an LPN to care for a patient with meningitis. Which task is inappropriate for the LPN? A. Administering oral antibiotics. B. Monitoring temperature every 2 hours. C. Assessing the patient's neurological status. D. Reinforcing the use of droplet precautions. Answer. C. Assessing the patient's neurological status. Question 28. Which task is most appropriate for the RN to perform in the care of a newly diagnosed epilepsy patient? A. Assist with feeding during meals. B. Educate about seizure triggers and medication adherence. C. Monitor vital signs hourly. D. Report intake and output to the provider. Answer. B. Educate about seizure triggers and medication adherence. Question 29. The nurse suspects the patient is experiencing increased intracranial pressure. What is the priority action? A. Notify the provider immediately. B. Perform a complete neurological assessment. C. Administer for morphine. D. Insert an oral airway. Answer. B. Perform a complete neurological assessment. Question 30. A patient with a spinal cord injury is experiencing a pounding headache and blurred vision. What should the nurse do first? A. Lower the head of the bed. B. Assess bladder and bowel distension. C. Give acetaminophen for pain relief. D. Notify the healthcare provider. Answer: B. Assess bladder and bowel distension. Question 31. Which intervention is appropriate during the postictal phase of a generalized tonic-clonic seizure? A. Place a tongue blade in the patient's mouth. B. Suction the airway as needed. C. Administer oxygen only if SpO2 drops below 90%. D. Allow the patient to sleep without monitoring. Answer: B. Suction the airway as needed. Question 32. The nurse is teaching the caregiver of a dementia patient about safety. Which statement indicates understanding? A. I will lock all exits to prevent wandering. B. I will use large signs to label rooms and doors. C. I will provide complete independence to avoid agitation. D. I will keep the lights off at night to promote sleep. Answer: B. I will use large signs to label rooms and doors. Question 33. A patient with a concussion reports increasing drowsiness. What should the nurse do first? A. Continue to monitor every 2 hours. B. Let the patient rest quietly. C. Perform a focused neurological assessment. D. Administer an analgesic. Answer: C. Perform a focused neurological assessment. Question 34. Which task is safe to assign to a newly hired UAP? A. Obtain vital signs on a stable stroke patient. B. Explain the use of walker to a patient with Parkinson's disease. C. Evaluate a confused patient's behavior. D. Perform a cranial nerve assessment. Answer: A. Obtain vital signs on a stable stroke patient. Question 35. What is the nurse's best action for a patient reporting photophobia, neck stiffness, and fever? A. Turn on the lights and assess visual response. B. Place the patient in a quiet, dark room. C. Encourage oral fluids immediately. D. Administer acetaminophen and reassess in 30 minutes. Answer: B. Place the patient in a quiet, dark room. Question 36. The nurse is caring for a patient with a brain tumor. Which change is most concerning? A. Mild nausea after eating. B. Dizziness when standing. C. Decreased level of consciousness. D. Occasional blurred vision. Answer: C. Decreased level of consciousness. Question 37. Which is an appropriate safety teaching for a patient with trigeminal neuralgia? A. Use a soft bristled toothbrush and avoid cold foods. B. Massage the face daily to prevent spasms. C. Sleep in a supine position to prevent attacks. D. Apply cold packs when in pain. Answer: A. Use a soft bristled toothbrush and avoid cold foods. Question 38. A patient has expressive aphasia following a stroke. Which communication method is most effective? A. Ask open-ended questions. B. Use written materials only. C. Provide yes/no questions and allow time for response. D. Speak loudly and slowly. Answer: C. Provide yes/no questions and allow time for response. Question 39. Which patient needs immediate nursing intervention during shift change report? A. A stroke patient with new-onset slurred speech. B. A Parkinson's patient who missed 1 dose of carbidopa-levodopa. C. An Alzheimer's patient who became agitated overnight. D. A seizure patient with a mild headache postictally. Answer: A. A stroke patient with new-onset slurred speech. Question 40. Which action should be avoided in a patient with increased intracranial pressure? A. Keep the head in neutral alignment. B. Suction only when necessary. C. Encourage isometric exercises. D. Maintain a quiet environment. Answer: C. Encourage isometric exercises. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.